Hi, my name is Emily Millard and today I'm going to be talking through the spine. So this structure here is the spine, also known as the vertebral column. This is the top of the spine, this is the bottom of the spine, this is the front, and then this is the back of the spine here. The top of the spine is where the head or the skull sits, and then the bottom of the spine is where it attaches to the pelvis. The spine is made up of 33 bones altogether. 24 of these are movable, and then the rest here are fused together. So we want the spine to be a structure that provides support and stability for the body and allows us to move and for movements such as bending and twisting. The bones of the spine are also known as vertebra or vertebrae if referring to more than one at a time. The spine is made up of 5 main regions. So we've got the cervical region here at the top, the thoracic here in the middle, the lumbar region, and then we've got the sacrum and the coccyx here at the bottom. Each vertebra, as you progress through the spine, is numbered appropriately to help with its identification and also with the name then specifically of the region that it refers to. So say for example one we've got will be C7 here, which is cervical vertebrae number 7. That's just an example. So firstly then we've got the cervical spine, which is made up of 7 bones altogether. These bones are C1 to C7, and the role of C1 to C7 is to provide an attachment for the skull, as well as providing a weight-bearing property as well. It allows for flexion and extension and also some axial rotation. C1 and C2 here at the top are very important structures in this region and are also known as the atlas and the axis. They are so important as they provide an increased range of motion that allow this area to move a lot more freely than the rest of the areas of the spine. The next region we've got is the thoracic region here, which is made up of bones T1 to T12, and this area articulates with the ribs. The movement of the thoracic spine includes rotation and some lateral flexion and extension. Next then we've got the lumbar spine here, which is made up of 5 vertebrae altogether, L1 and L5. And as you can see in this area, particularly the vertebral bodies are a lot bigger and a lot thicker than that of the vertebral bodies up here in the cervical spine. And as you can see, they get bigger as you progress down the spine. And this is because of the increased weight bearing demand that needs to supply and provide more stability than that of the top of the spine, which just needs to support the head, whereas at the bottom it needs to support the head and then the torso and the abdomen as well. So the movements of this area of the spine are limited to just flexion and extension. Then we've got the sacral region here, which is formed by the fusion of 5 vertebrae, and the sacrum is connected to the pelvis here and works to provide some strength and stability for the area. Then finally we've got the coccyx here, which is sometimes referred to as the tailbone and is made up of 4 fused vertebrae. The spine itself, as you can see when looking from a side-on view, has a natural S-shaped curve. You can see that the cervical and the lumbar spine have a natural curve inwards, and then the thoracic and the sacrum have a natural curve outwards. And this alignment helps to provide balance for a person, particularly when they're walking, so the weight is dispersed evenly and not just in a straight line, but it's evenly dispersed to help with a person to maintain their balance when walking. There are many key features then to consider when looking at the spine. So we've got the spinal cord that runs inside the spinal column all the way down for its protection. And the main role of the spinal cord is to be the main communication port for the body and the brain to carry its messages that allow us to move, that allow us to respond appropriately to the environment and feel some sensations. These here are the nerves that extend out of the left and right transverse processes of the spine, and each nerve extends to and has a specific role of the body. So the nerves here in the cervical region extend up to the brain and to the arms. Then the nerves here in the mid-back area supply the torso, and then the nerves here in the lower back supply the abdomen and the legs. However, sometimes there can be damage that happens to these areas of or these specific nerves, and these can have specific implications for a person's functioning. For example, having damage up here to the cervical nerves can cause a loss or detrimental functioning to the arms and the legs, and it's been kind of seen that as you progress up the spine towards the cervical region, the higher you are up, the more widespread the damage can be. In between each vertebrae, all the way down the spine, as you can see, there are these structures here, and these structures are called intervertebral discs. And around these discs, the aim is to be able to see a good range of motion and be able to move freely in order to keep them healthy. The role of the intervertebral disc is to act like a cushion that absorbs the shocks and the stresses that occur during movement, and then this prevents the vertebrae from grinding together and causing any friction. The discs are important structures for the spine and must have a significant level of blood flow to maintain their functioning and to be able then to provide the nutrients to the disc that it needs to survive. If a disc is starved of nutrients, this could be due to a lack of movement and in turn a lack of blood flow. This can mean the disc will start to degenerate, and by degenerate is where the disc starts to lose its spongy-like quality, which means it's not as much of an effective cushion as it once was, and also then the disc starts to thin out, thus not being able to provide the support that it needs for the spine. And as you can see all the way through for these nerves coming outside of the spine, they have a nice, in a healthy spine, they have a nice amount of room to move in. They're not compressed at all. However, as discs do start to degenerate, this space for the nerves to move within does start to decrease, and then this is the point where these can start to pinch on the nerves, and it can become quite painful for an individual, and if not treated, this process will just continue on, and the pain will start to increase for the patient.